So, good evening, everybody. Welcome to Ross-on-Wye Community Development Trust live broadcast this evening. My name's Jane Roberts and I chair the trust. And with me from the trust are Jane Maney, who's going to be looking after the questions as they come in and asking them on your behalf. And also Dr. Simon Lennane, who I'm sure many of you will know as a GP at Alton Street. And Simon's going to introduce our guest this evening, Karen Wright. Over to Simon.
Thanks, Jane. I'm delighted to have Karen along. Karen is the Director of Public Health for Herefordshire Council and has been, I would say, absolutely integral in the response that we've had to coronavirus since it started back in the spring. I've been working really closely with Karen and she is have been there all the way through, and so it's got a huge wealth of experience. So thanks so much for coming and joining us, Karen. We're really glad to have you along, and we're hoping to get lots of questions to come through. So please do post your questions on the Facebook chat. We've got some things that we wanted to talk about, and we've got some questions that we had already, but we're keen to make this as interactive as possible. I'm aware that this potentially could be quite a long winter, and this is one of the opportunities to have some of the discussions that we're missing out on face to face, and so really keen for it to be as interactive as possible. So have we got any questions to start with then, Jane? I think you're muted, sorry. You're muted, Jane.
Jane, you're muted.
Sorry, I'm unmuted now.
Try again.
Okay, so we'll go to ventilation, since that was a topic in the event invite. Dave has sent a question in. I run a restaurant in a listed building in town. When the lockdown eases, how can I ensure adequate ventilation in my venue when the sash windows don't open properly?
It's a really good question. We're recognising more and more about the effect of ventilation in terms of spread or protecting us from coronavirus infection. When it first started, it was a new disease and it was hard. We had to try and understand as much as we could about coronavirus, and there was concern about it being transmitted either by droplets or by fomites, which are basically surfaces that have the virus on it. What we're recognising more and more is that spread seems to be airborne. And so one of the really important things is to be changing the airspace that you're in as much as possible. I don't know, Karen, if you want to come in at any point on this.
Yeah, that's absolutely right, Simon. And I think that leads us to some very practical things that we can be doing. And I know that's happening in many of our schools. So, for example, by opening windows to get ventilation into areas. If you're going into a home and you're in a bubble with somebody who's vulnerable, then obviously maintaining your 2 metre distance. But again, if you get ventilation into the space, that's really helpful. And likewise within other workplaces, again, that helps to change the air, which is really good for us. A final one on that one that I think is helpful, although Simon's got a really good image to share with you, is that if you've got somebody who's vulnerable that you are working with and you do have to go into a car, there's some really practical things again you could do, or if you car sharing, and we try to get people to avoid this as much as possible, because actually it's been quite a cause of outbreaks and transmission of the virus. So if you're working and you do have to car share, then actually some situations you should be wearing the mask if you have to wear full PPE. If not, use face covering, but again, try and have somebody in the front of the car and the back of the car, and again, use ventilation to open the windows and just keep that air circulating. All those small measures will help to reduce the risk of transmission. So really practical things that we can be doing. Thank you.
It's a really interesting area, and it's one of the things that we get right. I wanted to highlight there is a really good set of graphics from a Spanish magazine called El País, which I have copied, and I will share with you now. But this is all based on really good science. But this is an example of a few people gathered together in a living room. So if you've got one person who is infectious, they are secreting the coronavirus particles each time they breathe. If there is no ventilation in the room, and after 4 hours, all of the people in that room will have been exposed to the coronavirus. If we use face masks, then it may be that some people will have avoided exposure, but still, after that length of time, then there's a really strong chance that most of the people will have had exposure. If we open the windows and make the duration much shorter, so if we cut it down to 2 hours, it's much, much safer. If we're changing the airspace regularly, if you remember, it's not about getting a single viral particle, it's about your initial viral dose. And if you get a lot of virus at one time, if you're exposed to this virus at one time, we know that that leads to a worse outcome. So what we're trying to do is reduce exposure, reduce the time of exposure, reduce the distance, and that's what keeps us well. Here's another example from the same article, which we'll link to. If we're in a bar, this is already a fairly quiet bar, but after 4 hours, the most of the people in the bar will have been exposed. These are the people in red. If everyone wears face masks, after 4 hours, still quite a few people will have had exposure. But if we get the ventilation right and the airspace is being changed regularly, we really, really help to reduce the spread of the virus as well. So I found this incredibly helpful to understand the impact of ventilation. And basically, if you imagine there's a kind of plume of viral particles around someone who's infected, the closer you are to them, the longer you are near to them, and the less protection you've got, the more likely you are to get an infectious dose of coronavirus. There's one more set of images, and this relates to a classroom. If you've got a classroom and say worst case scenario would be one of the teachers infected, because we know that particularly talking loudly, produces more air, more volume, is related to more viral exposure. And so after a couple of hours, if the airspace isn't changed, then we know that a lot of people will have been exposed to it. If we put face masks on that make a difference, if we open the windows, it really, really significantly reduces the infectivity of it. So we're really, really keen to try and get people to open windows as much as possible, try and change the airspace as much as possible, because that's what's going to keep us well. It's tricky going into winter, so it's really important to be dressed up warm and really get the windows open and change the airspace as much as you can. This is the final illustration from this, but if this is a combination, well, it's a illustration of if someone's not talking, there are very few viral particles, but they build up over the course of an hour. If someone's talking, you produce more viral particles. If you're shouting or singing, then there's a large production of viral particles, and people nearby are at significant risk. I found this really useful just to try and understand it, but it's a really good illustration, I think, of the effect of ventilation. And so in terms of coming back to the original question, if you can get the airflow through and trying to change the airflow as frequently as possible, then that's what is going to keep us well. And actually, that's how we open up again. The whole purpose of this is to try and reduce our cases so we can get back to normal. We can open up again if we can stop the spread. So that's why face masks are so important. That's why ventilation, I think, is absolutely crucial. Thanks, Jane.
Okay, thanks, Simon. Jane, do we have any more questions?
A couple more on ventilation. Sarah wants to know, do air purifiers at home work in the same way as open windows to reduce the spread?
I don't think so. There's a bit of stuff, Karen, correct me if I'm wrong, there's a bit of experimental research about humidity, and a higher humidity seems to help lung clearance, but not to any practical meaningful way. So I don't think they're changing it, and I don't think they're reducing viral particles in the air. Is that your understanding?
That's my understanding. I've certainly not seen any evidence that would show there's any benefit there. So I think it's back to that key message: ventilation through opening the windows.
And there's one more question on ventilation. Dave wants to ask, does a desk fan work in the same way as an open window to disperse the virus?
I don't think so. You're moving the same viral particles around. And so if anything, if you've got someone you're reducing the effect of social distancing.
Totally agree with that. Please, let's not have desk fans. Let's get windows open and get the air going in and out of the room rather than, as you say, spreading around. That's a good point around hand dryers as well, which we, discouraging the use of those, because again, that can be just spreading the virus if somebody's drying their hand under a hand dryer.
There's a really interesting thing about flushing a toilet. Flushing a toilet is what's called an aerosol generating procedure. And by doing so, you can actually, it can spread the air around in a room. So actually one of the things, particularly if you're at work using a communal toilet, is to put the lid down before you flush it. That seems to be really important. It's odd, these things that we're discovering, but always wear a mask in a shared area, and particularly in a small space like that is absolutely crucial. But there seems to be some benefit from reducing exposure to even things like that.
Okay, thanks. Oh, thanks, Simon and Karen. Okay, so Jane, what's the next topic that we've got a question on?
We've got a few questions on testing. PCR test reliability. False positive rate explaining asymptomatic cases. There's a lot in the media about this. Can you debunk it?
I'm happy to pick this one up. This is something that we do all the time as doctors, and there isn't such a thing as the accuracy of a test. It's much more complicated than that. I'll try and simplify it. But a test, we look at the false positive rate and the false negative rate. If a test picked up everyone with a disease and everyone without a disease, it would be 100% in terms of its sensitivity. It picks up everyone with a disease, but it's a useless test because it's not very specific. It doesn't exclude those people who don't have a condition. So what we're trying to do is trying to get a test that is sensitive, in other words, picks up those people with a condition, and is specific, in other words, it only picks up those people with a condition. Now, we know that the coronavirus test is, depending on how it's done, it's around 70% sensitive. There may be a degree of error if it's not done right. If you only kind of wave the swab at your nostrils, that may be the reason that it's less effective in those cases. But it is about 99% specific. What that means is about 1 in 100 positive tests for coronavirus are a false positive. In other words, they say that you've got coronavirus when you don't have. Now, this now starts getting a bit more complicated in that, and this is where the confusion has come from in the media. If the rates of a condition are very, very low in the population, and you test all of that population, the false positive rate becomes quite important. If you had, say, 1,000 people and only one of them has got coronavirus, you test all of those, you will pick up 10 cases of which only one of them has actually got coronavirus. But the issue is, and this is what some of the commentators have missed out, is that we're not testing everyone in the population. We're testing targeted testing towards people who've got the condition. And so actually this suggestion that lots and lots of tests are false positive is unhelpful and is a statistical kind of anomaly. So it's not that in practice, and tests are incredibly accurate. They are 99% accurate. If you have a positive test and you have symptoms, then we have to assume that you have it. So please take positive tests seriously. Karen, did you want to add anything on that?
Yeah, just to reinforce absolutely that importance of people attending for a test. There are some people who've been linked with cases, situations that haven't got symptoms that we have asked to go testing, but that's because we know their increased risk of being positive is there because we know that they're a contact of somebody and something that's going on. And it's great to see that we've got a better access to testing in Herefordshire now, which I know is one of the other questions actually. So you go on the government website, just Google NHS test, COVID test, and you'll get the link to the site, or through NHS 119 you can book a site. And when you do that, it will actually it'll identify the local test site that you've got. So locally in Herefordshire at the moment, we've got Merton Meadow, which is in Hereford, or there's also a site that's in Ross. If you go on there and there isn't an appointment available that you want, actually go back on the site, and that more appointments keep coming up. all the time. So please do, if you've got any signs and symptoms or you're asked to go for a test, please go ahead and get one. It's a simple process, and then isolate until you've got the results of that test, or also isolate if you've been asked to. That's really important.
Karen, I think that's one of the issues, that people haven't necessarily been isolating until they've had a positive test. Is that right?
Yeah, it is one of the things that's come up for us, yes. So that's really important. So if you get any signs and symptoms, so if you've got a new and continuous cough, if you're fatigued, I'm going to bring that one in, if you've got loss of taste and smell or a high temperature particularly, then you must isolate immediately. And that means not going to the shops, not going to visit anybody, go straight home and tell your employer. That's really important. Book yourself a test. Now, if you're one of those people that then hasn't got transport to get to that test, you can have a kit delivered to you at home and then get somebody to pick that up and post it for you. Or you can then, or obviously if you can, then go to a testing site, but you must isolate until you get that result. Something else that's come up actually is people who have been asked to isolate because they're a contact. They've gone for a test because they've chosen to do that. It's come back negative and they thought, oh no, I don't need to isolate anymore. Actually, if you've been asked to self-isolate, that you must do that, and that's that for that 14 days, because there's a period at which you may be incubating the virus. In other words, you've got it, but it's building up in your system. But and then there's a second period in which you may get symptoms, or you may not, but you are infectious, and that's why it's that 14 days. So if you're asked to self-isolate and get a test, please do it. If you get symptoms, get a test. And don't think a negative test means you can just go about your business even though you've got symptoms. It's really important.
Yeah, that's how we're going to break the chain of transmission. There's been a lot of focus, rightly so, on testing, but actually there's no point testing if you're not going to do something about it. So if you have symptoms, the most important thing is to isolate, because otherwise you're spreading it. We're continuing the virus, and we know that there are people in our community who are vulnerable, who are going to be put at serious risk if they develop coronavirus. For most people, it's a mild condition, but the problem is, if it spreads through our community, for some of us, it will be much more serious.
If I could add to that as well, Simon, that what we all want to do is to get society back to, how it used to be. And actually, even for the younger people who are listening to it thinking, well, it doesn't affect me. Well, actually, it affects everybody, because the more cases that we've got and the more transition within our communities, then the longer it will take to get the businesses open that we all want to have open for the livelihoods of those people, and actually for the quality of life of the staff and for the community of Herefordshire. So the more that we all do, making those small measures that will prevent us passing on the virus to other people, then the sooner that we can get Herefordshire open again, and be protecting all of us, children going back to school and seeing their friends. That will all happen sooner if we all do our little bit and prevent, stop the transmission of the virus.
Yeah, I think lockdown has been really damaging to a lot of people. I'm particularly concerned about people with cognitive difficulties, conditions like dementia, of being isolated. And we know that interaction is really important to keep people well and keep them engaged. We've, as a result of coronavirus, the meeting centre for people with dementia is now shut, and that's a real shame, because that was a real jewel in Ross's crown. And I'd love to see that back up again, because it's been really useful for people with dementia and their carers. So we're just really keen to get things back to normal, and the more we can do together, we're only going to manage this together. And so basically, if we all play our part, we can do this. But it's easy for it to spread if we're not focused on it. So it's the same message that we're giving, but I think it's a really, really important one, especially going into what will be otherwise a very long winter.
Okay, thanks both. That's really interesting. I was in communication with a friend in New Zealand today, and of course life is sort of more normal there, because they have actually managed to get this under control, and I think that's a really interesting contrast. I found it very interesting that if this is under control, we can actually get back to normal.
It shows it's possible. It's possible. It's just it just needs a concerted effort. And it's one of those times that we really need to pull together. Yeah.
Okay, Jane, what's the next question?
Just going back to symptoms, if I show mild symptoms, asks Karen, should I self-isolate before I get my test appointment, or can I still go out and shop with my mask on?
And I'll let you take that one.
Yeah, please, absolutely self-isolate immediately. That's just there's no question of a doubt. And there's something about all of us actually, when we're out and about, if we imagine, but we mustn't be this, imagine that actually we potentially do have coronavirus, and we imagine that the person next to us and others around us potentially have it, and treat it as a disease that can be, you know, it's not a nice disease at all. If we treat everybody on that basis, then we'll be really careful to think about keeping the distance, using our face coverings appropriately. Treat it like your underwear. Don't touch the inside. Wash it regularly. That's really important. You know, let's not wear it all week. Wash it every day. Only touch the sides. Absolutely key things, and washing hands thoroughly. So please, no, don't go out and treat everybody as though they've got COVID-19. And then I think if we do that, again, little measures that will help to prevent the transmission.
Okay, thanks, Karen. Okay, Jane, next question.
Okay, we've got some questions on vaccines now, Simon and Karen. We've got a question from Margaret. She says, I'm on immunosuppressant drug treatment. I was shielding during the first lockdown. There seems to be a lot of euphoria around the new COVID vaccine. Can I be reassured in any way that this has been tested on vulnerable people and will be safe and effective for the vulnerable? At present, I'm very reluctant to have the vaccine, as I think it has been rushed through all the various stages of testing, etc.
It's been developed quickly. It's been, I wouldn't use the word rush, because it has been done very carefully, and it's really, really important that we know that vaccination is safe. For any medical intervention, we're trying to weigh up the risks against the benefits. For someone who was immunosuppressed and shielding, we know that that puts you at more risk were someone with those conditions to develop coronavirus. And so what we're weighing up is, are there risks from the vaccine? Are there risks from not having the vaccine and actually being exposed to coronavirus? Vaccines generally are very, very safe. It's going to take a while before we get a lot of experience with this, but these vaccines are already in phase 3 trials and are being tested, and people have been having them for months, and they will only be released if there are no signs of serious side effects from it, and if they're effective. And so it's not a question of being a guinea pig. We're very, very grateful to volunteers and other people who have been true guinea pigs for the initial studies, because they're going ahead for us to check that these things are safe. And we can only do these, as with every medicine, they're tested on volunteers first of all, but we know that it's a serious condition. And so from this point of view, I think it's really important to say, actually, weigh up those two, and at present we believe the vaccination to be safe, and so I think the benefit will come out as having the vaccination. I certainly am going to have it when it comes out.
Yeah, and if I could just add to that, I think the important message here is, as Simon said, but it's that a vaccine won't be released until it meets safety standards. That is, even if the process has happened more quickly. And there are many changes that have happened across the, things that we've been trying a long time to do that we've got done much more quickly. But in terms of vaccinations, there are safety processes in place, and they won't be released until those thresholds have been met. And likewise with Simon, I'll be making sure that my mum, she gets her vaccine, because she's in that age group that would be would help them to get that, and I'll be certainly having mine. So absolutely.
The vaccination will be rolled out to people at highest risk, first of all, because they're the ones who get the most benefit from it. And so it's likely to go to people with chronic conditions and to the elderly, first of all. And then what we'll see is it will be rolled out progressively to younger and younger people as more stock comes on online, really. So we are preparing at the moment for essentially a huge vaccination program. GPs are used to delivering flu vaccination, and I've been in meetings today about how we can do this locally. We're really keen to be involved. We know our population well, and so we're hoping that it won't be long before we've got the vaccine and we're able to start delivering it, because that's another really important thing in terms of being able to get back to normal.
If I can just add something here as well, and obviously there's lots more detail around what and how and how that's going to happen. But I think what we also mustn't think is that, okay, now, so there is going to be a rollout of a vaccine programme to whichever groups at some point. And that means that we don't have to maintain our 2 metre distance, we don't have to wash our hands anymore. You know, it's going to take a long time for all that to happen. And it's really important that we still maintain respecting those preventative measures that we can all take, and including going for testing. So please, you know, that's the vaccine at some point will come, but it's important that we continue to do the right things. Otherwise, again, we put vulnerable people and the economy and you know, our children, everybody at greater risk in having this going on for longer and longer. So vaccines are part of the solution, but we all need to continue to maintain those behaviours that will help to stop the transmission.
Yeah, it's going to take a while before we're confident in the effectiveness of the vaccine, that we know how well it works. I mean, the news this week is really positive to say, you know, it looks to be effective, but how it plays out across a whole population is still to be seen. And so I can't see that I'm going to be ditching my mask anytime soon. I still will be taking lots of precautions and making sure that, you know, we're not inadvertently spreading to other people. Thanks, Jane.
Okay, thanks, Simon. So, speaking as someone who's in the sort of 65 to 70 age bracket, do you think I'll get my vaccine before Christmas or after Christmas? Otherwise, I'm perfectly healthy.
I would be surprised before Christmas, but I'd love to be pleasantly surprised. We're going to get it out. You know, when we start getting the first lots of vaccination, we're really keen to get it out. Partly is once it's been thawed, the one we're getting is likely to be stored at a really low temperature. Once it's been thawed, we have got a few days in which to use it, and so we're really keen not to waste any of these. These are going to be like gold dust, and so, you know, you may get me knocking at your door saying I've got a spare one. Come on.
No, I'm not looking to queue jump. I mean,
we just want to make sure we get them rolled out. So, you know, really important to get it done. But what we don't know is how many we're going to get, say, each week or each month. You know, that's still an unknown. We know it's going to be coming, and we're expecting it sometime in December, but we don't yet know the quantities, and so we'll try and keep people informed as we go.
Okay, thanks for that. Okay, Jane, next question.
Still on vaccines. Marie wants to know, I'm pregnant and in the at-risk group. Will the vaccine affect me or my unborn baby?
I don't think the tests have been done in pregnancy. With any volunteer program, or with any medicine, usually you start off on healthy volunteers and look to see how it's how effective it is, whether or not there are any problems. And so we try and keep these things away from people who are pregnant, because we still don't have the experience, and it wouldn't be ethical to go around injecting people who are pregnant. Having said that, some people who are volunteers will become pregnant, and then we look very, very closely at whether or not there are any harms from it. So it's going to be a while before we are confident in the safety of the vaccine during pregnancy. I don't know if you've got any further to say on that, Karen. I've not been able to see much about safety in pregnancy, and usually it takes a while for any new therapeutic intervention before we can understand better the impacts of pregnancy.
Okay, so Karen, did you have anything else to add to that? Or?
No, I think kind of similar to Simon really is that we'll get there'll be continuous research coming out around the vaccine, and safety is absolutely paramount. There's nothing I can add really. Thank you.
Yeah, we're going to learn more about it the same way that we've been learning all the way through. What does the condition do? What does it look like? How does it affect people? And we will be learning and looking really closely at the vaccine, the effectiveness, so possible any adverse effects. There are lots of vaccines in development, that's the other thing. And so it may well be, if there are some that are more effective, we will move towards those over time. But there's a lot of work going on around this as well.
Okay, thank you. Okay, so Jane, next question.
Mike wants to know, do we have to have the vaccine if we're invited to have one?
I think the answer to that is no. There is no mandatory vaccination. We would encourage people to have it, particularly for people at risk in the at-risk groups. But I'm not aware of any plans for mandatory vaccination, and understandably, people will have their own reasons. What I don't want is to be in a situation where there's misinformation around it, and that's been one of the problems all the way through coronavirus, is that people have been pushing out things that aren't necessarily based in the evidence. And you know, as I said, we will learn more about the vaccine, we'll learn more about the safety, but the trials are already ongoing, and as they report, we will get better. But there are no plans for kind of mandatory vaccination. Would you agree with that, Karen?
Absolutely. I think what's important is that we you know, that we share accurate information that is evidence-based, and that we obviously would encourage people to take up the vaccine, because that's in their individual and community interest, but people do have to make their own choice. But again, it's about getting the right information out at the right time to people.
Okay, thanks both. So Jane, any more vaccination questions? Or
one more. Andrew would like to know, is the new vaccine an annual inoculation, or do you only have to have it once?
I don't think we know yet. At the moment, the issue is going to be around whether the virus mutates. Over time, viruses often tend to change, and so if it changes in a way that the vaccination doesn't cover, then it may be that the vaccination becomes less effective over time. So for things like flu, we know that the influenza virus mutates over time, and that's why we have a yearly vaccination, and that contains 3 or 4 strands of the virus that is most likely to spread, that's considered most likely to spread. It has to be done a year in advance because it takes that long to make these vaccinations. So we choose the most likely strains, and then that's what's included in your annual flu virus or your flu immunization, your flu vaccination. For coronavirus, we're still learning, and the question will be, if it mutates, do we need to change the vaccine? There's a possibility it may be that we in the future will be looking at a yearly coronavirus and a yearly influenza vaccination, but I would say it's too early to say. What we hope is that single vaccination will provide lifelong protection, but that remains to be seen, and especially with mutations like we're seeing in Denmark with the mink farms, it's really important that we don't introduce new strains of coronavirus into the circulating strains, so that we're having to deal with different versions of it as well.
I think, as you mentioned, a flu vaccination, it's also a good opportunity to say, again, if you've not been for your annual flu jab, then please do go and get it, because there are some more supplies coming through. I know that actually take-up has been really good, but what we don't need to see is increased demand on all of our services, and also people being feeling unwell from flu, which is actually preventable by having the vaccination. It's also important as well because there's similar symptoms for people who've got flu and coronavirus. So again, if you've been invited for your flu jab and you haven't done so yet, please go and get it. And then if you have an opportunity through your pharmacist to go and get your flu jab, please go and do that, because we want to see as many people as possible taking that up, because again, that helps to protect our population and protect our health services, and keep people well.
Yeah, we've got more stock coming back in. Because it's been such a good uptake this year, we did run out of stock temporarily for over 65s, but there's more stock coming in, as Karen says, and it's been a really good uptake this year, but there are still some people we need to reach, and we know that if you get coronavirus and influenza together, that makes the condition more serious. So really important to try and get people protected. We're so keen on it.
Yeah, if I can add to that as well, there'll be people maybe listening to this or tuning in that are also, they've either got relatives who are vulnerable and or care workers or, you know, working with vulnerable people who maybe feel not sure about having it, or I've never had flu and therefore actually don't need to have the jab. And it's really important that some people don't get the symptoms of flu, but are actually, they are infectious and therefore they can pass on that infectious. So I do encourage people, please do take the opportunity to get a flu jab, because again, that's all part of protecting vulnerable people. Even though you think you've never had it yourself, you don't always know.
Flu's horrible. It's really nasty. It takes weeks of your life, and sometimes it can take months to recover to normal. We know there's a serious effect to people who are vulnerable. So, you know, it's a preventable condition. So flu jabs are so important.
Okay, thanks both. I've just noticed there's a couple of vaccine questions come in on the comment thread underneath our live feed. Sam wants to know if the vaccine contains eggs, presumably, and therefore wouldn't be suitable for people with egg allergies.
I don't know about that. I believe it may contain gelatin, and and I'm sorry to say, I was told that it contains pork gelatin, which is frustrating because that will put off some people who, for religious reasons, are unable to access it. Gelatin's an important constituent of these things, but I don't know this for sure, but I've seen some suggestions that it may be contained. We will have to get back to you on that, and we'll try and find some more information around it. A lot of vaccines, egg is used, and so we have to be careful, but it's a tiny dose, and so for most people it's not an issue. Karen, is that your understanding of it?
If I'm absolutely honest, I'm not sure, so I can't really comment, sorry. We can look into it.
Coming through, but thank you. That's a really good question. I will try and find out, and we'll get back to you on it. But the details are still coming through. We're getting updates. I've had about 5 updates today about the vaccination program, because there's lots of movement on it, and so it's very quickly shifting. But it's a really good question, so thank you.
There's the question from Alexandra. Where can I find the right information about COVID? There are too many conspiracy theories around.
Yeah, it's one of the reasons that we've been doing these Facebook Live events, is just to try and present, hopefully, a kind of consistent and sort of from local experts and people involved in the field, really. So that's really good. The NHS sites are very good. Karen, are there any that you particularly find useful?
Yeah, and we've actually put links to all the sites on the council website, but I think you're right. Well, it's true, actually, the NHS website, and also there's the mod.gov has got lots of information on there. But if you go onto the council website, then we've got all the links to information. Some of that has also been actually kind of simplified. I'm not being patronising, but it kind of, some of it in bite-sized chunks, which is quite useful. We have also got links to the information that's really helpful to businesses, to different settings and to schools, because we work with all of those settings in terms of actually unpicking what the guidance is and how to implement it, and some really practical tools. So again, if there's anybody tuning into this who are running a business locally, or involved in a school or a setting, then if you go onto the council's website, we've got links to lots of really useful information that will help you in putting the practical measures in place and getting the latest advice.
I think it has been tricky. The guidance has changed a number of times, and a lot of that is related to the change in science and also related to the kind of change in circumstances. We knew winter was going to be tough, and so as a result of the latest lockdown, the guidance has changed again. So I think it's really understandable to want to try and get the latest updated information, because things go out of date very quickly. So it's useful to be able to get trusted information.
Yeah, and I think that's a really good point actually, Simon. So there's the links that we've got there, and you could say, well, why does it keep changing? And it is because there's a constant learning. It is a pandemic. We've never had a pandemic like this before, and we are consistently learning. And then some of the guidance that's put in place, for example, for schools or businesses, that they may get feedback to say, well, actually, this bit's a bit confusing. So there's changes that are made, and with the very best intentions, not to create more confusion, but having feedback to say, well, there's a better way that we can explain this, or some of the learning, such as ventilation that we've learnt about. You know, a long time ago we weren't wearing masks, but the evidence showed us that actually wearing face covering, sorry, get the right terminology. So it's constantly bringing the learning in that then informs how that guidance is being written, and then how we actually communicate it out to people.
Thank you.
Okay. Okay, thanks for that. So Jane, what's the next question?
We have a question about outbreaks of COVID. Edward has asked, people have been saying that the outbreaks of COVID come from local farm workers. Is that true?
Karen, Karen's very experienced with this, having managed some farm outbreaks over the summer. I'd not heard of anything. Karen, have you?
No. So I think we did have the huge farm outbreak way back in July, wasn't it? But no, there are outbreaks across Herefordshire, as there are outbreaks across you know, the whole country in different regions. And no, that there isn't evidence around farms. I think what's important is to look at, so in many situations there are common themes around where we do get outbreaks. I think the first thing is that we will get people who do pick up coronavirus. Obviously, you reduce the risk massively by following the guidance that we've just been talking about. And we've got household transmission, we've got some transmission in workplace and in our communities. So the more that we follow that advice, the better, but it's coming from different areas. And what we do within the council and working with our colleagues in the NHS and other organisations is we try and understand where the first cases were. So we look back, working with people to say, where do we think this has come from, and to join up different cases. And the reason that we do that is to make sure that there isn't a source of transmission that we haven't got hold of, and that's the way that we prevent it spreading. So it's come from, you know, across the country within households. There's things that you can do to prevent transmission in households, as we've been talking about. So one thing is not having a load of people into your house, which we know is not allowed now, but again that was happening. And again, if you're in a support bubble with somebody who's vulnerable, just remember not to go and hug them, but actually to respect the keeping your distance, washing your hands, using face coverings and ventilation, because it's those things that will help to spread infection. So it's coming from different places, but all those measures that we can take, that we've talked about, will help to actually you know, to reduce the transmission of the virus.
Thanks. I said we'd be interactive, just as a demonstration of it. A colleague of mine in the NHS has just texted me to say there's no egg protein in the vaccines. They're genetically developed. At some point in the process, egg protein has been used, so it may be not suitable for some vegans, but we're still waiting for confirmation on this. So thanks very much, Francis, for the update. I really appreciate these kind of live updates and keep them coming.
Okay, that's great. Okay, so next question, Jane.
Okay, I think this is probably one for you, Jane, and it's about the Ross Good Neighbours scheme. What is the Ross Good Neighbours scheme doing to keep the buddies safe when they do shopping for the vulnerable?
Okay, thanks. That's a really good question. So we have a health and safety policy, and under that we have to look at all the activities that we do and do risk assessments. So we have done a risk assessment for the shopping operation. We've identified the various risks. I mean, not just COVID related. I mean, you know, the risk of sort of people putting their back out by carrying bags that are too heavy for them, for example, those sorts of things. And we use the risk assessment then to issue guidelines to the buddies, so that they understand what the risks are and how they can operate safely within them. And so the main things we're doing is asking buddies to socially distance when they're going around shops, and actually at the point of delivery as well. It's a source of some sadness to us that we can't actually currently, you know, if the buddy is invited in for a cup of tea, they're not actually able to accept that, because we have told the buddies that they cannot cross the threshold at the moment, and that's very sad, but it is, in fact, you know, we've decided that it's a necessary precaution at that time. The guidelines also emphasize mask wearing, as you would expect, and hand hygiene, as you would expect. So those are the main things that we're doing to keep our buddies safe. And could I just sort of pay tribute actually to the buddy team and their wonderful energy and good humour, and willingness to sort of you know, get involved in the community and help out their neighbours, because without them the shopping operation and the Good Neighbour scheme simply wouldn't work. So thank you, buddies.
Yes, absolutely.
Okay, Jane, another question?
Yeah, we've just got a couple more. Do you think lockdown will go on beyond the beginning of December?
I hope not. Really hope not. There's we're starting to see a slowdown in cases as a result of lockdown. We did last time, and it would be really nice to get back to normal, but I think we need to see a reduction in cases, and it's something that I don't think we'll know until much nearer. I don't know, Karen, if you're hearing anything through the kind of official channels.
I think, I mean, you know, those kind of decisions will need to be made. And again, I'm totally with you. I hope not. And I think the important thing for us to remember that the best chance we've got of coming out of the current measures is by everybody following the rules. And then, you know, those decisions have to be made in the future. But you know, I'm with you. The more that we do, that we can actually prevent the transmission, then the sooner that we actually get to much less restrictions being in place.
It was horrible the first time walking through Ross and seeing all these shops closed. It just felt not like a ghost town, but it was just so quiet, and it felt kind of resting. And I just don't want to go through that again. We know how damaging it is for economically for local businesses. It's a really good opportunity to try and support local businesses where possible. It's the independents, the local businesses, who are the people who are most vulnerable to these. They don't have the resources of the multinationals. So anything you can do to support local businesses just helps to keep our town running, so that, you know, we can get back to normal as much as possible. That's so important. We know that the economics is really intrinsically linked to health and to the other outcomes of things. You know, how dangerous unemployment is to health. So these things are all absolutely integrated to each other.
Yeah, and I think another thing that's important here is again, and it sort of becomes the stuck record, doesn't it? But as we kind of move through the months, I think it's again, whatever happens, you know, and obviously we do hope that we absolutely come out of lockdown. But what we don't want to do is then people go back to behaviours of actually getting closer than 2 metres and then undoing the good that's been done through this period. So it's really continue to respect the virus and respect the harm that it can do. And as you say, absolutely support the local communities and local businesses. Can I just mention as well, I think it's the work in Ross is absolutely fantastic. And if there's people who are tuned into this who are from wider parts of Herefordshire, that if you have been asked to self-isolate and that creates, you know, financial difficulties or other difficulties where you do need support, then the council, through the working with the fantastic community in Herefordshire, has got the Talk Community Response. So again, go onto the council website and you can see how you can access that, and that again, that can help people to get support with you know, with getting shopping and other things if you haven't got your, you know, that support network around you at home. I think it's also worth people thinking, well, actually, if I am asked to self-isolate because I'm positive or because I am a contact, do I know now who I'm going to call on to help me to get medicines, to get shopping? Who is that person? Actually, who would walk the dog? Some really practical things. It's worth having your own plan so that, you know, and you know, with your friends and families, think, what's the plan that we've got in place? So if and when it happens to us and with that in that situation, we know who we're going to talk to, we know who's going to be our support to get us through that time. And that's really important. And it's fantastic. The amount of volunteers in Herefordshire is just absolutely brilliant. There's a really good Herefordshire way of doing things, which means people aren't alone. they are there to be supported. And as you say, absolutely support the local businesses. That's the way we keep Herefordshire as buoyant and fantastic place that it is.
Okay, thanks, Karen. I think one idea that came up last time, which might be worth just reminding people of now, is that it's worth looking at your food cupboard and maybe just stocking up a bit with things like long life milk and maybe a loaf of bread or two in the freezer, so that if you do suddenly learn you have to self-isolate, you have actually got some stuff you can just fall back on, which would reduce the need for other people to shop for you.
You won't get any notice if you get unwell. If suddenly it happened to a friend of mine, was having tea and recognised that they couldn't taste it, and so all of a sudden, from that moment, you have to isolate. You can't pop out to the shops and go and stock up on food. You have to have done that bit before, or make sure you've got neighbours or friends or the buddy scheme to be able to get these things in for you. But please don't push it and think, oh well, it's only the mild, because actually that's the time when you're the most infectious. That's the time when you're putting other people at risk, and you could easily infect a number of people. So it's really important to think about these things beforehand, making sure you've got medicines in stock to be able to get through a couple of weeks. The pharmacies will deliver if necessary, but just think about these things beforehand. It's so important.
I think just adding to that as well, Simon, if you've got people who are, running businesses in Ross and other parts of Herefordshire, again, make sure that you've got your kind of resilience plan, because you could suddenly find, and you're more likely now to find that you've got one of your members of staff who are positive or a contact, because there is more transmission in the community. If you've got somebody who is positive and they're working very close to their colleagues, have you got people organised into bubbles, so that you know which bubbles actually would be effective and would need to self-isolate? And have you got your plans in place so that you can continue to run your business? Obviously, people shouldn't be going into the workplace if they can avoid that, but obviously that doesn't apply to everybody. And if people are struggling, thinking, I'm not really sure if we're doing the right thing, and you do want support, again, there's plenty of guidance on the council website, and we have got the Outbreak Control Hub, which involves environmental health officers and public health officers and trading standards who've been supporting businesses. And we've been running sessions such as this with the agricultural community and with other settings. So there's kind of question answers. So get involved in those things that are happening to support you. But again, prevention is far easier than thinking, oh, I wish I'd organised staff in bubbles, or I wish I'd looked at the kitchen space, because actually people are still making each other drinks, sharing the kettle. Somebody still got a biscuit tin. If you've got one, get rid of it. Let's not have it. And biscuits are no good for you anyway. But actually, you can imagine all the different hands. And these are the kind of things that have been coming up in areas across the country, the really basics. So again, treating everybody, your colleagues, as though they have got COVID, keeping the distance, and that's the way you'll keep your business going, as well as reducing the risk of transmission and protecting each other.
Okay, that's great. Thank you. I think probably we've only got time for another 2 questions now. Jane, can we have our penultimate question, please?
Muted, Jane.
Jane, I think you're muted. Jane, I think you're muted.
Sorry. Sorry. I've had email through from Harold. As a care worker, mainly looking after elderly patients, will I get priority for the vaccine?
Don't know yet.
Yeah, I think you would be fairly high up the list. We're still waiting on the actual prioritization, but as a care worker, particularly if you're going between clients, then I would say I personally would put that very high up on my list, because you would be high risk of transmitting the virus between people, between vulnerable people. So yes, but I haven't seen the final guidance on how it will be done. Karen, have you seen it yet? I've seen versions, but I'm not sure that any of them are final.
No, we haven't got any final information about how that process or who will be prioritised. So no, we're not able to say anything, add anything.
Yeah, but care workers, I think, would be considered anyone working in health and social care, I think, would be considered high risk because of the chance of transmission to others.
Okay, thanks for that. And Jane, our last question for this evening.
Sam is asking, with the outbreak of bird flu in Leinster, is it something else we need to be concerned about?
It's the year that keeps giving, 2020, isn't it? Karen, I don't know if you got any thoughts on that.
Yeah, no is the answer. So no, there isn't any concern. I think let's focus on COVID, but any people that have been that need to be aware of what's happening in that situation in terms of any risk to human health. But this is a strain of the virus of bird flu that's actually it's just in birds and not in humans. So no, there's not a concern.
It's the jumping species that's the risk, and although it's not great, it's not posing any risk to humans at present, I think. Yeah.
Okay, that was quite a straightforward one. So I think, Jane, we might be able to squeeze in one last one.
Go on, one more.
I think we can, and it's probably worth it. It's from Chris. To what extent do you think Hollywood is to blame for some people not taking this pandemic seriously? Not only are there no flesh-eating zombies, but we cannot even see bodies on the street. How to convince people that 50,000 deaths is an alarming statistic, even though they are out of most people's sight? Simon.
I think that's a really interesting view. It's sort of, I think we have been conditioned to expect, you know, these kind of worst case scenarios, and it's not as dramatic as that. You know, there are definitely, I don't know how many people I've talked to with COVID this week. I suspect it's in the double figures, and that's been going on for a few weeks. There are definitely cases in our community. We've definitely had deaths earlier on in the case. But I'm connected. Lots of people won't know anyone who's got coronavirus or who's been diagnosed with it. It doesn't mean it's not there, and it's definitely there in our community. But the reality is much more kind of straightforward, and you know, we're not going around with hazmat suits on. What actually happens is the meetings, is the environmental health people checking on people, is much more down to earth, much more practical stuff rather than the Hollywood things. And as someone who's become involved in the outbreak group, I'm just full of praise for the amazing amount of work that goes on behind the scenes with public health colleagues of just who are keeping us well. And most of it is unseen to the system. You know, these things go on and most of us don't know it's happening, but we would notice very, very quickly if it wasn't happening. So a huge amount of work from Karen and her colleagues, and I'm just really grateful for it. It's been a privilege to see it up close.
But do you think there is movie potential then after the
I think there are lots of questions that need to be asked. I think there are some interesting questions looking back, and there are things that I think we could have done differently. But actually, locally, I think the response has been exemplary, and all the way through. You know, I'm so proud of the town and the way that people have come together. And that's not going to make a film. You know, dropping around to someone, making sure they've got milk in isn't very photogenic, but actually, that's the practical stuff that's going to make a difference.
I think that's really important, actually. It is a whole Herefordshire approach, isn't it? From residents, from actually the people who are collecting refuse, through to those who put in markers on the streets, people to volunteering, which is amazing, through to the people who've been working in social care, which has been really difficult, and then stepping up alternative ways of discharging people from hospital. So there's so many parts of our of business, you know, businesses. I helped my daughter with her paper round, and I met the butcher this morning, and he said that since March they've been working from 2 o'clock in the morning, because by doing that they've got a smaller group of people working to make sure that they're looking after, you know, the local residents. So it's those kind of things, whether it's somebody working in, you know, shops, or they've changed what they've done and dealt with some real challenges, and it's through everybody working together that actually we're going to get through this, you know, in Herefordshire. And it's so many people's efforts, and as you say, it's those people behind the scenes, so you don't see what they're doing. And we've got environmental health and the police are going out doing to our market towns and into Hereford on a Friday and Saturday evening, you know, late into the evening, to actually to remind people about the right thing to do, and to issue fines, to be fair, to those people who aren't doing the right thing. And we don't want that to happen, but it has to happen if people choose not to follow the rules. The vast majority of people are working incredibly hard in our business. And you think about the work that's gone in businesses to make them COVID secure, it's massive. It really is. So, you know, well done to everybody. The vast majority of people of Herefordshire, whether you're working there or living there or volunteering, you know, to do the right thing to keep Herefordshire safe and keep the economy of Herefordshire going.
Okay, that's great. Well, that means I think that's it for tonight. I mean, the fact that it's not going to be a movie, it means I don't have to ask you who you think you should play yourself. Anyway, so I just need to end by thanking Karen very much for coming to talk to us this evening. It's been really helpful, and thank you for all the work you're doing across the county, really, to keep us all safe. Thanks, Simon, as ever, for being involved and being such a so supportive of the CDT pre-COVID and post-COVID. And to thank Jane for fielding all the questions and for generally keeping us on track. So thanks for that. Okay, and thanks to everybody who's been listening. I can see there are some questions in the comments feed that we haven't managed to get to tonight, but we will answer them in that feed. So do pop back tomorrow or the next day and or over the weekend. We will try to get to all of them and make sure that your questions are answered.
Just before we go, I'm really keen that we keep this going. I think it's so important to keep these channels of communication going. I'd love to feel that they're not always about health. You know, at the moment it's particularly pertinent subject, and we set this up when we had cases going up in Ross, but we would like to keep these going on an occasional basis and really to use them to highlight a lot of the other good things that are going on Ross. We're missing the chance to have these conversations. We don't have kind of town halls and forums for these conversations to happen, and so that was one of the ideas behind this, is just to keep talking to each other, make it as interactive as possible. And so what we may see is in the future these move towards a more kind of magazine format, or trying to cover other aspects of all the good things going on Ross, so they're not just purely health based, but we'll certainly try and keep going on updates and making sure people are up to date on what's happening locally as well.
Absolutely. So it's watch this space. But thank you very much, everybody, tonight, and good night.
See you all next time. Thanks. Cheers.
Bye.